Hello viewers, in this video we are going to discuss about home visit. My name is K. Priyadarshini, working as a lecturer in MMM College of Nursing. Now we will see the objectives of this video. Define home visit, explain the purpose of home visit, list the various principles of home visit, enumerate the purposes of home visit, describe the advantages of home visit. See the definition of home visit. What is home visit? Home visit refers to meeting the health needs of the people at the doorstep. Home visit is a process of providing nursing care to the people at the doorstep. Purposes of the home visit. Home visit, as compared to the clinical visit, it gives more accurate assessment of the family structure and behavior in that environment. It also provides opportunity to identify both barriers and support for reaching the family health promotion goal. The nurse can work with the client or family members directly to adopt the intervention to match the resources. Visiting the family in their home also contribute active participation in meeting their health needs. Effect of the home visit are always positive and it is very much cost effective too. To provide domiciliary midwifery as care for the pregnant women, delivery, puerperal mother and the infant. And with home visit, we are able to give care to the sick, to the postpartum mother and that newborn with a view to teach a responsible family member to give subsequent care, to assess the living condition of the patient and his family and their health practices in order to provide the appropriate healthcare teaching. It provides basic healthcare services for treating the minor elements. It provides counseling on family planning, immunization, and nutrition to give health teaching regarding the prevention and control of diseases. To establish close relationship between the nurses and the public for the promotion of health if possible because of home visit. To make use an inter-referral system and promote utilization of community services. These are all the purposes of home visit. Principles of home visit. The home visit should have a purposes and the objectives. Home visit should be planned according to the priority. And the purposes of the home visit should be clear, regular, and flexible based on the needs of the family. In the home visit, first we have to introduce ourselves and the institution where we are coming and your purposes of home visit and collect the fact about an individual family and the environment. Always, home visits should be educative. Home visits should give excellent opportunity for the nurses to demonstrate the hygienic principles. It should be convenient, acceptable, and educative to the patient. Maintaining the good interpersonal relationship between the family and the um, have the characteristics of polite, courage, and friendly. These are all the important thing of home visit. Carefully listen the family and understand the other person's view. Health education, nursing care should be scientific based one. Use technical skills and the scientific nursing procedures for taking care of the family. Involve all family members as much as possible during nursing care. The nurse and the family members must develop a positive interpersonal relationship in their work. Then only both together they can able to achieve their goals. Evaluate your own work periodically. The nurse must respect the patient's rights. Home visits should be recorded in the diary and the family folder. Next, we are going to see the steps of home visit. Totally, there are 7 steps. Number 1 is fact finding, data finding, planning for your visit, action and health education, closing the visit, recording the visit, and evaluation of the visit. Totally, there are 7 steps in the home visit. Next, phases of home visit. Totally, there are 5 phases: initiation phase, pre visit phase, during home visit, termination phase, and post visit phase. Totally, there are 5 phases of home visit. First phase, initiation phase. In this, community health nurse informs informs the family about the purposes of visit, and usually community health nurse used to introduce herself and also obtain information about the family members. One pre-visit phase. In this, the community health nurse assessing the whole information about the house, example, location of the house, a distance, address, need for home visit, physical and environmental status, family and cultural background, occupation, income, all the things about the family. This information is obtained from family folders or other healthcare agency, etc. Third one is during home visit. This is very important thing. In this, the community health nurse should develop trust and rapport with the family members, introduce herself to the family, establish a good nurse-patient relationship, to take permission from the family members prior to entry into the home or knocking the door of the house is essential. Accept the culture of the family, explain the purpose of the visit, and acknowledge each family members and seek cooperation from them for their care. Use effective communication skill to implement the nursing process. Assess the family needs and plan the nursing care according to the needs. Plan and implement the nursing care. The next phase is termination phase. Nurse patient goals are reached, health is restored. So, patient can function without nursing action. Nurse transfer the patient care to the another nurse or other members to provide health care. In addition, nurse have to review the visitor, family members and plan for future visit. Post-visit activities. After this home visit, then I should document their and record, we should maintain Pakka documentation and recording and reporting. Evaluate about how far the relationship is maintained, effectiveness of the teaching or care provider, whether the patient or family member is able to recognize and identify the uh, needs of the family members family. How will we will be able to know the frequency of home visit? The frequency of home visit is usually depend upon many factors: extent of health needs, extent of health problem of the family, need felt by the family, family's ability to deal and cope with healthcare problems, and family regularity in home visit. Those are all the major thing decides that how many times the home visit is needed for that family. Advantages of home visit. It is actually the time saving one. Be able to save the family members time. Enhanced comfort is possible, better accessibility, personalized care is possible in this home visit. Economical options, we know about see directly we are entering into the house and we are assessing the economic background of the family. So economical options it's available. Flexible services, better care for elderly patient is possible because most of the time the major problem encountered by the elderly people is reaching to the healthcare institution. It's a major issue. Somebody assistant is needed to reach the healthcare institution, but with this home visit, it is be able to provide better services for the elderly patient and support for caregivers. These are all the advantages of home visit. To summarize this, we have discussed about definition of home visit, purposes of home visit, steps, and what are the principles followed, 5 phases of home visit, and advantages, how many, what are, how we able to decide the frequency of home visit, all those things we have discussed. Thank you so much, everyone.